Hi, I'm Mina Olson, and here today I'm talking about men's health and some things that are important to men as we're celebrating Men's Health Month this month. So I just wanted to put it out there that men are not exempt from pelvic dysfunction. A lot of times we think that women are the ones that are suffering with pelvic pain or urinary leakage, but it is quite common in men as well. So some stats that I wanted to share with you is that for pelvic pain and prostate pain, that affects 10 to 15% of the U.S. male population, which is a pretty significant amount of people. Also, 1 in 5 men experience some type of urinary incontinence as compared to 1 in 3 women. So it is more prevalent in women, but men are not exempt from having these issues. And something that we see often in the clinic in the pelvic PT world is that pelvic pain and urinary incontinence can be related to different conditions of the prostate. So some conditions that we see often are chronic prostatitis, which is an inflammation of the prostate, and it can lead to a lot of various urinary incontinence type problems. So urgency, where you have to go to the bathroom very quickly, frequency, where you're going to the bathroom quite often during the day. Also, the feeling that you can't quite completely empty your bladder or burning with urination. Those are common complaints related to chronic prostatitis. That's something we see in the clinic here. There's things that we can do for that by treating the pelvic floor, working with the patient on trying to change some of their habits. And patients do really well with physical therapy for chronic prostatitis and helps them quite a bit with the pain with urination and some of the urinary changes they may be having. Another thing that we see often in the clinic is complications after prostate cancer. So after the prostate is removed because of prostate cancer, there can be some damage to the surrounding structures of the pelvic floor and the structures near the bladder. And that can lead to urinary incontinence, and it's very common after prostate removal to have some urinary incontinence, some leakage of urine. So we in the pelvic physical therapy world, we are helping patients regain control of their bladder by strengthening their pelvic muscles and working through some habits and tips to help make the patient more comfortable. If you have the luxury of getting in for pelvic PT prior to having the prostate removed, there's better outcomes for patients if we can get you in before you have the surgery, teach you some really great things, get you working on your strength before you have the surgery, and then come back to us after. Even better outcomes for those patients. So that's just a little window as to what we do in the men's health world relating to the pelvic floor, and hope to see you again. Thanks.